Good morning, I'm Jessica Lovell, and today we bring you an encore presentation of one of our very favorite programs. This one focuses on weight loss drugs. 6% of all adults in the United States are currently using a GLP-1. This includes brand names like Wegovy, Ozempic, and Zepbound. Right now, our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. However, if there is an urgent update from the health system, we will be here to let you know first. Please, until then, enjoy this encore presentation and make it a great day. Coming up today, do anti-obesity meds live up to the hype? How do GLP-1 drugs change your body? We explore the effects, both expected and surprising. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Ozempic, Wegovy, Mounjaro, Zepbound, these brands are leading what headlines call a revolution in weight loss. And by now, you likely know someone who has used them. The Kaiser Family Foundation found that 1 in 8 American adults say they have taken a GLP-1 drug, whether that's for diabetes, heart disease, or for weight management. And these drugs are showing surprising potential that go way beyond your stomach. Today, we are asking what is happening inside your body after the injection. I am joined today, next to me is Cynthia Zabrowski, who works here at the health system and is here to share her experience taking a GLP-1 drug. Good to have you.
Thank you.
Thanks for being here to share. She is a patient of Dr. Joanna Finkel, an OBGYN and obesity medicine specialist here at the health system. Good to have you.
Thank you for having me.
And on the research side is Dr. John Tifo, director of the KU Diabetes Institute, and is one of the principal investigators leading KC Moore, the Kansas Center for Metabolism and Obesity Research. Good to have you.
Thank you.
And in just a few minutes, we're going to be speaking with Katie Harvey, a registered dietitian and eating disorder specialist. We'll ask her about GLP-1's potential role in helping people with binge eating disorder. But Cynthia, I want to start with you. I want to clarify you did not have any sort of eating disorder.
No.
But can you share with us what got you started on a GLP-1?
Oh, sure. I'm probably a typical woman who used to be super active, multitasking and raising a family. And as we became empty nesters, probably a more sedentary lifestyle, not making the best choices, and the weight gain became more significant. Also, when the kids get older, unfortunately, I get a little older too, and words like menopause and postmenopause, and it became harder and harder to lose even a little bit of weight. So that became more significant for me. So I just needed some help.
Yeah. And
I was lucky enough to find Dr. Finkel and have been blessed with her helping me along a path that included the GLP-1.
So did you start before, I believe, menopause? That's like a dirty word in my book now. But did you start before it or right in the middle of it or after? Okay. And which drug did you start with?
I started with Saxenda, and I got on that with my primary care provider, but I was not able to tolerate that, and it really wasn't worth it to me with the consistent daily side effects, the nausea. So Dr. Finkel was able to put me on the Wegovy.
So we have some pictures. We always like a good before and after picture before starting the medication. I have to say, I was looking through these pictures and you look great in all of them, but did you have a goal in mind? Was there a weight goal? Do you mind sharing where you were at or where you were trying to get to?
Sure. Cringe. No one likes to see the before pictures. At least the dog is very cute. Yes, I just wanted to. I've been successful. I've been able to, with Dr. Finkel's help and with some hard work, able to lose about 30 pounds, which on a 5'3" frame does make a difference. A goal in mind, I just really want to have a healthy, active lifestyle. I'm not trying to live my glory days, but it does make a difference to just lose a little bit of weight. I think I'd maintaining about where I'm at this point.
Did you make some changes in your lifestyle?
Absolutely. With Dr. Finkel making me accountable for a lot of changes, just much more active, walking 5 or 6 times a week. I discovered pickleball, and I'm not very good at it, but I love it, and it's so much fun. So playing that a couple of days a week, and it's important to get the weights in as well. So I try to do that a couple of days a week. So along with trying to work on what I'm eating.
Dr. Finkel, the queen of accountability. So I want to look at those photos again, if we can, because I think a lot of viewers might think that Cynthia doesn't look obese, and sometimes we associate these kind of medications with somebody who's really, really overweight. Who are these drugs for?
So there are classifications. BMI is what we use right now, but there are other measures that we're going to be using, such as waist circumference, basically taking into account someone's adiposity and where it's located, because that can predict metabolic disease, and I think that's very important. But for right now, we're sticking with BMI categories, and it's basically someone with a BMI 27 to 29.9 with a comorbidity, something related to their weight, so like high blood pressure, diabetes, high cholesterol, sleep apnea. If they have one of those conditions plus a BMI over 27, they qualify for the medications, or if they have a BMI of 30 or over.
So Cynthia, how do the drugs make you feel? Did you have any issues?
For me, when I was on Saxenda, as I said, it really wasn't worth it. Just that constant nausea, it wasn't worth it to me. So it took me I was off of those and then found Dr. Finkel a little bit later. And Wegovy, it's been a positive experience. I have had 2 episodes that weren't very good, but they were self-inflicted, I think, when I did not take my medicine quite on time, waited a few days later, and on a higher dose did experience some not so good things.
Any other surprising side effects that you weren't
surprising side
Did it
effects?
Change your taste at all of anything?
Well, I would say anybody who knows me knows I'm a total foodie. I love to cook. I like to go out to eat even more. I knew that the portion sizes were going to be smaller, but I was even surprised at my reduced portion size. In terms of taste, I probably don't enjoy beef as much as I used to, but I don't necessarily associate that with the Wegovy.
You mentioned being a foodie, because I think about that all the time. I was going to ask you if you find yourself feeling differently about food, because it's tough to be a foodie and then somebody who's trying to watch their weight. Somebody wants to go out to restaurants and try new things and indulge sometimes. How do you see food now? Do you see it differently?
I definitely see food differently in that it's important. I have to be more selective, because I want to lose fat. I do not want to lose muscle. So I have to prioritize protein. And in doing that, if I'm going to a restaurant and I'm starting with the bread basket or the chips, I might not make it to the entree. Or if I'm at home, I have to start with a protein shake in the morning, or get some eggs and cottage cheese or something like that. Or the rest of the day, it may not go as well with the protein. So
docs are both shaking their head. The protein, I know I had to rethink protein in my life myself. Dr. Finkel, from your perspective, is this pretty typical what you're hearing from Cynthia with patients that are trying these
in terms of side effects, you mean?
Yeah, side effects and success.
Yeah, so in terms of side effects, nausea, vomiting, diarrhea, or constipation, I mostly get some nausea when we're going up, and that's why we go up slowly on the doses. And then a lot of people talk about how the food noise is quieted down. So I constant thinking about what's in the fridge, what am I going to eat next, what's my next meal, constantly thinking about snacks. That all goes away. And so I have often the opposite conversation with patients once they're on this medication for a while, which is you need to eat, and we need to have a lot of protein, at least 60 to 80, grams once we start, and then I start increasing it from there once we meet goals. But making sure that they're having meals, that this is not, a diet where we don't eat.
Yeah, this is not a magic injection, magic pill.
No.
Cynthia is a good patient then, because she's really being mindful about what she's doing.
Yes, and it's a conversation, multiple visits over multiple times, where we give goals and then we kind of achieve them. So working with patients to teach them about nutrition and about what choices, just like Cynthia said, you make in terms of food. Now that food noise has gone away, it allows you to make better health choices.
Food noise, I like the sound. That's an interesting way of describing it. Dr. Tifo, you're kind of shaking your head in agreeing. From a researcher perspective, what kind of insight are you getting from this conversation so far?
Well, first of all, we need to pay more attention to the effects of menopause and how it affects women's weight and how they feel and all these things we're talking about. So there needs to be more research and more places for women to go when they're going through menopause to counter these changes that occur with weight, so we can try to protect against occurring in the first place, I think. Second of all, these drugs are a great tool to help people give that boost. And so by losing 20 or 30 pounds, I'm sure you feel stronger and more willing to be active, right? It just feels great. And a lot of times when we have one health success, a second health success follows, right? So if we get more active, then we feel like we should eat better, and then we feel like we should do this and this and this. So, it's a great tool to give people that boost and to get them started. And it's wonderful that there's a healthcare provider here who does it in a way that really prioritizes all the other things that need to go along with it, not just handing out a drug. So it's a great story, and it's the way it should be done.
So explain the basics. What is the GLP drug designed to do inside your body? What's happening in there?
So it's a hormone that's produced from your gut when you eat a meal, and when you eat a meal, you also produce a hormone called insulin, and insulin tells the cells in your body to take glucose out of the bloodstream and store them away or use them. And so as people become insulin resistant, the insulin doesn't promote that as well, and so we get more hyperglycemia. Glucose goes up higher. So the drugs were originally developed, and so what GLP-1 does is it helps the pancreas make even more insulin, okay? And as people get insulin resistant and diabetes, the GLP-1 actually gets cleaved in the circulation of the system, and it doesn't have the ability to make the pancreas make more insulin. So what they discovered, though, by doing all these studies that were first focused on diabetes treatment, was that people were losing weight, and they reported being more full and having less satiation issues, which means how hungry they are between meals. And there were studies in rodent models and humans that kept showing this, and so they started looking at it as a drug for weight loss. And now we're where we're at today, which is it's a powerful tool for weight loss.
So we know there's side effects from losing weight. How do you know it's the side effects of losing weight, your body changing, or the side effects of the medication?
Well, first of all, let me highlight. I should highlight that the drug seems to affect satiety, so it makes you more full. It also slows down the gastric emptying, so it makes one of the reasons it makes you stay full is your stomach doesn't process the nutrients as quickly, and so the whole digestive process slows down a little bit. So those are. And then it affects signaling parts of the brain that drive hunger. So, what was the question again? I wanted to get that in. I'm sorry.
Well, just how I appreciate you saying that, but just how when we're losing weight, our body is going through changes, especially if you're losing a bunch of weight in a short amount of time. How do you know that, like with Cynthia, she had to swap drugs?
Yeah.
So how do you know it's the effects of the weight loss versus if you need it's a side effect from the medication?
There's just so much evidence over the years that just a little bit of excess adiposity causes insulin resistance and elevated inflammation and all these other things that cause cardiovascular disease and negative health outcomes, that it's probably most likely the loss of adipose. But there is some really pleiotropic effects of GLP-1 on different systems of the body. For example, it helps the cardiovascular system. There's the cells that line your blood vessels are called endothelial cells, and there's really positive effects of GLP-1 drugs on those cells as well that helps regulate blood pressure. So there is some off-target effects that seem to be really positive so far.
Is that regarding the study?
Select trial.
Yeah, the Select trial found that these drugs can maybe prevent heart attacks and strokes. Just can we dive a little bit more into that, because that's interesting?
Sure. So the Select trial there had been previous evidence in people with diabetes that GLP-1s lowered mortality over a certain number of years. And so what they wanted to do in the Select trials, they wanted to get people that did not have diabetes but were obese. Now they did choose people that had already had a cardiovascular event or had cardiovascular disease. So they enrolled around 17,000 people, and they did a placebo dose versus the GLP-1, and they found that there was lower mortality in the people on the GLP-1s. Now, they had also lost 10% more weight than the people in the placebo. So it's hard to know if it's a GLP-1 effect specifically or a GLP-1 through obesity. I lean towards the 10% weight loss being the primary driver. But as I said, GLP-1 seems to have these off-target effects that seem to be positive.
Dr. Finkel, it can increase your heart rate? Is that what I understand?
Yeah, so it works through the parasympathetic nervous system, a part of your nervous system, and it also affects like the vagus nerve, and so it can increase people's heart rate. I don't get a lot of those complaints. I actually have not heard anything from my patients that they feel that their heart rate is increased, and when we measure their vitals, it may be slightly increased.
Any concerns regarding bone density?
Yes, so I'll start first. So yeah, there is concern with bone density, especially in my population, older women. So I counsel a lot specifically about maintaining muscle mass. So you don't just lose fat and water, you also lose muscle. And so making sure that you're doing, like Cynthia said, strength training. So some form of strength training, resistance training, so that you can maintain your muscle mass. It helps with that, as well as maintaining, vitamin D levels. So we talk about a lot of that in my practice, and then body composition scales, and you can address a little bit more on the research side of things.
Sure. I mean, with menopause, there's a loss of muscle mass and a loss of bone mass as well. So if we all of a sudden ask women to lose a bunch of weight and there isn't the counter exercise program to maintain muscle mass and bone mass, that could lead to physical function problems down the road, which we don't want. You want to maintain activity, right? So it's really important that these drugs be used the way Dr. Finkel's using them in a combined therapy with lifestyle and the drugs.
I tell people I don't want to make you thin and frail. We want to maintain that strength.
All right, let's turn to Katie. Bring her into this conversation. You help people with eating disorders. And Katie, these medications can change how people think about food. How does it do that?
So it appears to do it in a few different ways. What we're seeing a lot of people reporting is that it decreases the food noise that they were talking about earlier. And with eating disorders, it's essentially this constant chatter in the brain that is thinking about, what am I going to eat later? What did I already eat? How many calories have I had? And for some people, really strong compulsions towards eating, even if they're not hungry. And so with these drugs, it's like we're quieting that down, and they can finally listen to their body and make decisions that are more attuned to what their body actually needs.
So you found that GLP-1s could be helpful for treating binge eating disorders. What is BED and how does a GLP-1 help?
Binge eating disorder is a type of eating disorder where people have strong compulsions towards eating, and they may experience a loss of control around food and eating large quantities of food. And because of this, we do see a lot of medical comorbidities with binge eating disorders, such as diabetes, and we also see PCOS quite often, pre-diabetes, insulin resistance, cardiac disease. And so we've got a lot of overlap here with the things that these drugs treat and binge eating disorder. And what I'm seeing in my clinical practice is that the drug is helping people in really meaningful ways with their health, and it's helping them with their eating disorder because they're able to stop eating much more easily, and they're not having as many binge episodes.
Do other eating disorder specialists feel the same? Is this a common thought process?
So largely the eating disorder field is pretty concerned about these drugs. There's been a lot of concern expressed, and for good reason. We don't want people abusing these drugs to lose weight who don't need to be on them, or using it to become malnourished, or for people with anorexia and people who shouldn't be taking the drug in the first place. So of course we don't want to be making those types of eating disorders worse.
So what do you say to people?
We also
go ahead,
have,
please.
Yeah, go ahead.
No, please. I'm sorry. Go ahead.
Well, I was just going to say, I'm starting to hear more openness towards the utility of these medications for the binge eating disorder population. So we have to look at the type of eating disorder a person is struggling with.
It's not that, not one size fits all as far as that go. And it's not a magic solution. There's a lot of layers there for sure. So what do you say to people who feel like diet and exercise, that should just be good enough?
My response to that would be, if that was going to work, we wouldn't even need to have this conversation. Like,
Correct.
If diet and exercise is so clearly not the solution to weight problems or eating problems.
All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. The information is there on your screen. So, Cynthia, have you run into any issues when it comes to like insurance or even supply?
Insurance, no. However, as I've started moving towards a maintenance dose, it's been very hard to get the lower dose for myself, most recently.
So, Dr. Finkel, there have been articles suggesting people on GLP-1 drugs have increased fertility. Is there much research supporting this?
So there is research supporting it in the specifically polycystic ovarian population in that syndrome. So there's been studies showing that natural conception is increased, people ovulate more, their menstrual cycle becomes more regular after weight loss. They're losing on these drugs anywhere from 15 to 25% on the newer drugs. And so after that, their menstrual cycle becomes more regular and they're able to conceive.
So on that note, just what is the overall impact to hormones?
So it does seem to increase FSH, which is a follicle stimulating hormone. It seems to have effects directly. There's GLP-1 receptors on our ovaries, on our endometrium. So there's some preliminary evidence, at least on animal data, that it does help with implantation, making the endometrium healthier, decreasing inflammation. So there may be other pathways in terms of infertility that's not related to like what we call anovulatory bleeding, meaning that you're not having regular cycles. So someone who's having regular cycles but really has infertility that needs to be resolved with IVF, for example. Those patients who are really not sure if GLP-1 is going to help them, and that's an area of research that is currently being developed.
And Dr. Tifo, we mentioned the SELECT trial earlier. Newly published results from that trial found that people on GLP-1s had a higher chance of surviving COVID. Explain more.
Well, I think it was a little bit of sensationalism from journalism. It was something like 62 perished from COVID out of the 17,000 who were not on GLP-1 versus 42. So it was, it's 20 people, but it's 20 people out of 17,000. So it was statistically significant, but, I think it's something that the journalists kind of poached on. But it probably had to do with weight, the weight status. So, people who are obese have a chronic inflammatory status that's a little bit elevated. Their cardiopulmonary function is usually not as good, and so COVID works through those mechanisms. Whole body inflammation and really affecting the ability to get oxygen into the system and distribute it. So, those, having a little bit of weight loss probably did protect those people.
What else is happening in the world, the research world, when it comes to these medications?
GLP-1. Mm-hmm. So I was just at the European Association for the Study of Diabetes, and Amgen and AstraZeneca, they were rolling out their new drugs. So they continue to make new compounds that put different hormones or different antagonize or activate different receptors along with GLP-1. So the most recent one is an amylin receptor plus GLP-1 receptor, and they were rolling out 20% weight loss in 1 year in human patients. And one of the studies showed that 70% of the patients had nausea, and so I'm like, okay, are we overdoing it here? So the drug companies continue to look for bigger, more efficacious weight loss. And I'm not always sure that's the best. I think losing, the data is pretty clear. If you can lose 5 to 10% weight, your mortality risk goes down about 50%, and I worry about trying to shoot for 20 or 25%. And it's not sustainable. We don't want yo-yoing, and that's what happens. It's going to happen with these drugs too.
There are some oral drugs that are coming out too,
yes,
and those I think are important because they're also GLP-1, but they're going to be oral now, and so that'll open up the door for patients that aren't able to have the injectables and open up the market a little bit because we are having some supply issues. So
and will that make it easier to maintain supply when they're not injectables? I would think so.
I think so, and I think for people that are maintenance, that may be an option too, to be on something oral rather than injectable, and so I think it's going to open up the options for patients. Providing more options is really what we want.
Yeah.
Katie, question for you. Do you see these medications being used for mental health?
Yeah, so there is some research showing that there may be benefit for things not just like hunger and food cravings, but also cravings for things like alcohol and other substance abuse and addiction. So there may be utility there. And I think time will tell the way that this plays out in the mental health field in general, but I do think that there is some promising research and some signs that that might be feasible. And so we'll see.
Let's get to some questions from our viewers this morning. And Kim wants to know, do these type of medications cause muscle loss?
So the research right now is suggesting that it may cause some muscle loss. So just like I said, when we lose weight, we don't just lose fat, we lose water, and we lose lean muscle mass. And so we're trying to preserve at least 30% lean muscle mass. And so strength training really helps with that. So it depends. It depends on how much you're adhering to the advice of your physician.
All right, Lisa wants to know, are there suggestions on how to maintain on Mounjaro or Zepbound? Can you go every 14 days?
So there's different ways of getting to a maintenance dose. For some patients, I talk about reducing the dose. So the maintenance dose can be 1.7, it can be 1 milligram. Everybody's different. This is tailored to this particular patient. And so, we have to kind of see if the food noise comes back. Some patients I'll do 1 dose every other week. Some patients can be on 1 dose a month. So it looks individualized patient care.
Stu wants to know, what is Saxenda and is it still prescribed?
Saxenda is liraglutide, and it is still prescribed. It's a daily GLP-1 receptor.
And that's the one, Cynthia, you were on originally.
Yes, it was. It's currently the only one that is non-branded, so there isn't a one that's non-branded that's liraglutide.
Jeremy wants to know, do these medications have any effect on PCOS?
Oh, looking at me?
Do you want to try that one?
I'll let you. I would assume so.
Yes, there's evidence that in some studies that they have effects in reversing the effects of polycystic ovarian syndrome. More research is needed. The studies are limited, but there is preliminary evidence suggesting that.
Yan Liang wants to know, we know that GLP-1 medications may delay gastric emptying to reduce appetite. I'd like to ask if using this type of medication could potentially cause symptoms of acid reflux or nausea.
Potentially. I mean, I think part of the nausea is the slowing down of the gastric tract.
Yeah, I generally treat the nausea not with Zofran or with other anti-nausea medications. I really advise against that because, for example, Zofran can cause constipation, and you're already getting constipation from the drug, so then it just really worsens that. So often I'll say try a little bit of Pepcid. We'll either try Pepcid before, so a medication for heartburn, a couple days before, or just take it consistently, and that can sometimes have a real effect on that nausea.
Cindy wants to know if you hit a plateau in your weight loss, does that mean that the drugs have stopped being effective?
No, sometimes we need to change around the exercise routine. Sometimes we need to change the protein. We kind of need to stop and see what's happening, but sometimes we need to increase the dose. So as we titrate, we're also looking for how much weight you're losing. Are you losing about 2 pounds a week or so? If it starts so you're not losing anything for several weeks, then maybe perhaps we need to go up on the dose.
Cynthia, thank you first of all for just talking about your story and sharing your experience. What's the big takeaway from this conversation?
I think the takeaway for me is a little over a year and a half ago, I was the highest weight that I'd ever been in my life. And I was also turning 60, and it's already hard enough to turn 60. But I started worrying not only about the weight gain, but the overall health, my overall health. So I would say that taking the initiative to make a change is hard. Losing weight, even with the GLP-1s, is hard, but the overall benefits are incredible. Just feeling like you are taking control a little bit of your own health, just living a more active lifestyle, just confidence and mental well-being, and just knowing that you are working to be the best person that you can be at any age is well worth it.
Great message. Katie, what's the takeaway?
I think the takeaway is that we have to stay open-minded, that there's going to be pros and cons to any medication, but each person is so different. Everybody has different health needs, and that we just need to be open to trying different things and seeing what works for different people. But we also do have to be, careful and making sure that these are being used appropriately.
Dr. Tifo, what's the takeaway?
I agree with that. I think this is a great tool for people who are struggling with obesity, which is really a product of our modern environment. It's hard to escape, and so if we can leverage these tools with really good health care, it's going to help us become a much healthier country.
Dr. Finkel, wrap us up. What's the takeaway?
I have one for medical professionals. I really want to, since this talk has been a lot about binge eating disorders and other eating disorders, I want to advocate for making sure that you're screening before prescribing, so screening for any binge eating disorder so that you can be aware. And then for patients, I really want to say, making sure that your goals are aligned with health, not a specific number or specific BMI, but more health goals. Can we help you with your blood pressure by lowering your weight, as Dr. Tifo said, by 10%, improve your diabetes risk, all those things. So looking at your health profile, how are you feeling? Are you more active? Are you better able to run around with your grandkids? The health measures that we really want to focus on rather than, getting down, because that can take us down through that path of eating disorders.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.